Breaking headline on Capitol Hill. Senator Rand Paul testing positive for the coronavirus as Congress negotiates that massive stimulus package, now growing to at least $2 trillion. At least 2 other senators placing themselves in self-quarantine.
We chose for NHS resource reasons to ask from today that gatherings over 500 people would stop. My wife was at the Stereophonics concert. I think I would send my wife to the Stereophonics concert if I thought there was danger. I went to see my parents yesterday. I have 2 79-year-old parents, one with respiratory disease. Do you think we haven't thought of all the things
Why
you're
would you
suggesting?
send your wife to a concert with 12,000 people? I'm sorry, but you're supposed to be in charge of public health. You can see what's happening around the world. Why on earth would you want your wife in the middle of this?
Because I read the science. The science tells me that mass gatherings at this point in our trajectory are not a danger to our public health.
Why is the rest of the world shutting them down? Why in Austria can you not even, in Austria, have gatherings of more than 5 people, but there's you, a public health official in this country, sending your wife to a concert with 12,000?
Because Professor Leach says he's seen the science.
Yeah, but what science are you seeing that the rest of the world is not seeing?
Wholly inappropriate. You would think there was nothing going on in parts of New York City. You would think it was just a bright, sunny Saturday. I don't know what they're not understanding. This is not life as usual. None of this is life as usual. And this kind of density, we talk about social distancing. I was in these parks, you would not know that anything was going on. This is just a mistake. It's a mistake. It's insensitive, it's arrogant, it's self-destructive, it's disrespectful to other people, and it has to stop, and it has to stop now. This is not a joke, and I am not kidding.
I want to say that I know that this is a challenging time for all Americans. We're enduring a great national trial, and we will prove that we can meet the moment. I want to assure the American people that we're doing everything we can each day to confront and ultimately defeat this horrible, invisible enemy. We're at war. In a true sense, we're at war, and we're fighting an invisible enemy. Think of that. So it cost me billions of dollars to be president, and I am so happy I did it. Because who cares? Who cares? I'm really happy with the job we're doing. And I'm glad that this team and me are here for this horrible thing. I mean, a number of people have said it, and I feel it, actually. I'm a wartime president. This is a war. This is a war, different kind of a war than we've ever had. But I'm a little upset with China, I'll be honest with you, because as much as I like President Xi and as much as I respect the country and admire the country, I have great admiration for the country, what they've done in a short period of time. Of course, our previous presidents allowed that to happen. You should say thank you very much to all of them. But they should have told us about this. And I did ask him whether or not we could send some people in. They didn't want that. Out of pride, I think really out of pride. They don't want us sending people into China.
Our viewers, that a potential deal, a more than $1 trillion stimulus package that we thought was coming together, there was going to be a procedural vote. At this point, it seems as though no deal tonight against the backdrop of this.
That is absolutely my biggest takeaway. Over the weekend, I've been speaking to business leaders, banking executives who said it sounds like things are getting closer and closer. They're in close contact with Secretary Mnuchin. But the fact that no deal happened tonight, that's devastating for individuals, small and big businesses alike.
After a doctor who treated her was diagnosed with the coronavirus. On Friday, Merkel, who is 65, was vaccinated against a different virus by the doctor, who later tested positive for COVID-19. Merkel's spokesman says she will now undergo daily testing. Her last act before going into quarantine was to announce sweeping restrictions on freedom of movement and social interaction.
The number of UK deaths has been rising at a faster rate than both Italy and China at the same stage of their outbreak, both of which experience unsustainable pressure on their health services. As we know,
the city of Cremona in northern Italy, at the heart of the country's coronavirus crisis. Another 651 deaths nationwide over the past 24 hours, and almost 4,000 new contagions.
Do you think concerts should carry on? I mean, should there have been one at the weekend?
Yes, there should have been one at the weekend.
And you would have been happy for your wife to go to that?
I would have gone myself.
Really?
Yep.
So even as the rest of the world locks down, you as a public health official in the UK think it's perfectly okay to go to mass gatherings?
I do, for public health reasons. However,
how
from
can there
today,
be a public health reason in telling people to wash their hands every 2 hours, which is the only advice, while you sing happy birthday, and then going to a group of 12,000 people all sweating and massing around each other? How does any of that make sense?
I'm not sure where your masters in public health came from, Piers, but this is not, public health is
it's a master in common
as straightforward.
Today he wrote in 2 newspapers, the Sunday Times and the Sun, urging people, don't visit Mum today. The Sunday Times also alleges the Prime Minister's chief advisor Dominic Cummings had initially been keen for the country to adopt a policy one observer characterised as herd immunity and let the old people die, but had been convinced shutting down the country was a better option after seeing what was happening in Italy. Downing Street denounced the report, saying it was a highly defamatory fabrication. Channel 4 News has learnt that French authorities were preparing to shut down the border with the UK on Friday afternoon.
Cases 15,000, total number of new cases 4,800 new cases.
The president of the American Hospital Association describes this pandemic as a once-in-a-century event. He is urging Congress to provide $100 billion in emergency funding to ease shortages at medical facilities. In hard-hit areas, testing resources are too scarce to screen anyone for the virus except healthcare workers and hospital patients. Some say they fear that doctors could soon have to make some tough choices.
Business is grinding to a halt across the United States as local governments step up efforts to contain the coronavirus, while economists are predicting a lasting impact on the U.S. economy and our healthcare system as well. Treasury Secretary Steven Mnuchin is forecasting, quote, a gigantic fourth quarter. Watch.
You're going to see a lot of pent-up demand. So I think you're going to see, when we get through the next few months and Americans see what's happening and we've killed this virus, people are going to be comfortable going back to work. We're going to be opening back businesses, and people are going to continue what they do.
Advice, and don't think that fresh air in itself automatically provides some immunity. You have to stay 2 meters apart. You have to follow the social distancing advice. And even if you think that you are personally invulnerable, there are plenty of people that you can infect and whose lives will then be put at risk.
Tonight, nearly 1 million drivers on the job nationwide, delivering whatever you order amidst rising fears.
Could someone have it? Is the package contaminated?
Richard Hooker says the worry starts in the warehouse, where coworkers say companies are putting them in close proximity to those who could carry COVID-19.
No soap, no hand sanitizer, there's no cleanliness at all. But we're essential. Now they're telling us we're essential.
If the epicenter of the coronavirus outbreak in Europe is in Lombardy province in northern Italy, then the absolute center of this epidemic is here in the town of Bergamo. More people have died here than anywhere else, and they still are every day. The virus storm swept through these beautiful ancient streets. This medieval town and its modern city is utterly locked down. Only a few venture out. Everyone knows someone who has died or is ill, and everyone is scared.
Even the buzzing heart of Manhattan has now gone quiet. All non-essential businesses must stay closed, and their workers must remain at home. It's part of a stringent set of rules coming into force as New York scrambles to contain its surge of coronavirus infections. Under pressure from state governors, President Donald Trump has now pledged to send help to the states worst affected by the outbreak, including New York.
The sound of gratitude. Spain's emergency service workers showed their support for the medical staff working around the clock to care for the nation's soaring number of coronavirus patients. Health workers have been struggling with the huge stretch on resources. There are no waterproof gowns. The colleagues protect themselves with garbage bags and trying to get the protection that the hospital does not give them. Waiting rooms have been set up to treat patients without oxygen, neither respirators, and the situation is in chaos.
Just last night, the Federal Bureau of Prisons announced that the first federal inmate has tested positive for COVID-19. According to the agency, the inmate remains in isolation at the Metropolitan Detention Center in Brooklyn, and other inmates he was housed with are being quarantined as well.
Now advised that only those with severe cases seek medical help. Inside hospitals tonight, there's growing concern.
It's a scary time to be a doctor in America, and especially in New York.
Dr. Cornelia Griggs, a mother of two, is a pediatric surgeon who works with coronavirus patients at Columbia University Medical Center. She says she's worried the hospital could run out of masks, eye protection, and gloves. Her message on Twitter, "Don't make us orphan our two toddlers."
I'm tired, I'm stressed, I'm scared. I'm an ICU doctor and I don't really scare that easily, but this is scary.
Walking in to start the day. Here is our medical team. They're making paper rounds before we go into the rooms. Walking in the ICU, going to my scrub machine because I do not want to bring this stuff home. Start with a gown so that we don't get secretions on us. Put this gown on. You see the goggles so we don't get droplets in our eyes. And then we have two face masks on. We put gloves on underneath, then we put another set on top. Here we go. That's pair number one going on now. I'm going to do that for each patient in every room. A very, very cool invention by our nurses. So they put very long tubing, and they've been able to bring the pumps from the patient all the way outside the door and work the pumps from here. You can see a lot of times we have to put our patients upside down, and we manage our ventilators and take care of them and try to get them off the ventilator as fast as we possibly can. We're doing our best. Very long day, though. Lots of patients, ICUs full.
Bank find there and look to see whether or not your bank has that FDIC insurance to ensure that your money is safe. Up to $250,000 per deposit account is usually the amount that's insured, and so you want to make sure that you have that type of insurance on your money to make sure that your money is safe.
Pope Francis called for worldwide prayer to tackle the coronavirus crisis in his Angelus message on Sunday. The Pope has been delivering the message via the internet and TV from inside the Vatican instead of in front of crowds in St. Peter's Square.